Hi, my name is Nitin Kukkar. I am an orthopedic surgeon and I work for SIU School of Medicine. We have an SIU orthopedic clinic in Quincy and we have been based there for 2 years. My specialty among orthopedics is doing spine surgery. First meeting with the patient is very important. I have a lot of patients who come and say, "Doctor, I have nerve pain going down my leg. I have a disc problem." But my first question to them is, tell me what you feel, not what you have been told. Because my purpose of seeing them is to know what they feel and to treat what their symptoms are, and not what the MRI or other doctors have told them. I like to talk to the patients quite a bit, and I very seldom offer them any surgery when they first come to see me. I like to establish a relationship, to get to know them better, to follow them for a little while before we make any decisions about the treatment and care. Why did I choose orthopedics and spine surgery is a very good question. Actually, there are things that impact everyone's life. When I was very young, when I was 5 years old, my father had an accident. And he actually had a very complex fracture of the knee and was almost on the deathbed. And you have to think that it was 1985. But he survived it and he was in crutches for 2 years before he could walk ever again. When I entered medicine, my father wanted me to become an orthopedic surgeon. And with having that fascination in my mind, I did want to become an orthopedic surgeon too. So I chose orthopedics. Then I was in medical school. I had a disc herniation. After that, I had to work through physical therapy and a lot of other things. So when I was choosing spine surgery, people said, "Oh, don't do it. It's such a long surgery. You shouldn't be choosing it." But I chose it, and I'm very happy that I did it. I can relate to patients very closely because I went through some of it. So that kind of relation that I know that in my mind, what goes through a patient's mind is actually very helpful. And I do want to do spine surgery because of that reason. I think surgery is scary. And I tell my patients it's okay to be nervous. If I have to hand myself to another person for making any decisions on my body, I would be scared too. Education is the ground where we stand. If we don't educate the patients, then the outcomes are not great. Studies have shown that if the patients know what they are getting into, their outcomes are much better. And we do things a lot better than that way that we used to do. But human body is still human. We still take some time to recuperate and to improve our function. And to get that, where the patient is able to function on themselves alone without any help and to excel in life, is the hardest part in spine surgery. It's not the surgery itself, it's the restoring of function after surgery.